Helen, I'm a midwife at Kettering General Hospital and I am part of the planned caesarean birth team. I'm just bringing you a short video today about the Birth Options Clinic. This clinic is currently running by telephone appointment. It normally is done face to face, but obviously because of the recent COVID-19 it is now a telephone consultation. Now this appointment is for ladies who have had one previous caesarean section. It gets booked in when you go to your booking appointment by the community midwife. You come and see the planned caesarean section birth team at the Birth Options Clinic between 14 and 16 weeks pregnant. At this appointment we will go through your previous caesarean section, what happened there, and we will then discuss the options moving forward for the birth in this pregnancy. There are two options available for you. One is that I'm going to discuss in more detail today is about vaginal birth after caesarean section. This is called VBAC also. And the second option is to elect to have another caesarean section. Today I'm just going to concentrate on a vaginal birth after caesarean section. A vaginal birth after caesarean section, or a normal delivery after a caesarean section, there is a 75% success rate, with obviously a 25% chance that it could end up with an emergency section. There is a risk that where baby lives, so the uterus, there's a scar on that, and there is a risk that this scar could open up when you are in established labour. This risk is quite small. It's about 1 in 200 women that it could happen to. We would offer you a caesarean section when you get overdue by 7 days. So when you get to your due date 7 days over, we would book a caesarean section in for you because we have to have an end date for the pregnancy for baby to be delivered. The reason why we do it at term +7 is to give you the best possible chance to go into spontaneous labour by yourself. Quite a lot of women do go overdue, so it's just giving you that extra time to be able to have your baby normally. With having the section at term +7, we do offer stretch and sweeps from 39 weeks. So you have a stretch and sweep at 39 weeks and 40 weeks. This is done by the community midwife. And this just tries to hopefully stimulate you to try and promote natural labour. If this doesn't happen, obviously you'll come in to have your caesarean section at term +7. Now, when you come in for the caesarean section at term +7, you don't necessarily need to have the caesarean section then if you don't want it. The doctors can examine you on the day to see whether your waters could be broken. If your waters could be broken, you'll wait to go down to labour ward and have them broken, and then they'll see if that will stimulate you to go into labour, and there'll be a plan put in place by the doctors on labour ward for that day. If you do go into spontaneous labour before term +7, then you need to ring labour ward up as you normally would when you start to come into labour. Then when you get into the hospital, once you're in established labour, the midwives will need to monitor you and monitor baby's heart rate with a machine that goes onto your tummy. I don't know whether you know what they're called, but they're called a CTG. Now these machines stay on for the duration of the labour until baby is delivered. Now this doesn't mean that you can't be mobile. We do have machines in the hospital that are telemetry, so they have no wires attached to them, and it just means that you can stand up, you can move around, you can go on all fours, as long as we can pick baby's heart rate up safely. That is a possibility. In labour, you'll also have a cannula put in your hand and send some bloods off, just as a precautionary measure, just because you are a previous caesarean section. Now, in labour, there is a lower threshold to go to theatre if the labour isn't progressing as it should, so the cervix isn't opening up as quickly as they would like, or if there's any concerns with baby's heart rate at all. They will have this discussion with you and they'll decide whether you want to carry on with the labour or whether you want to go for a caesarean section. Now, if any complications arise in the pregnancy and you're wanting to have a vaginal birth after caesarean section, but baby needs to be born earlier, This might mean that you will have to have a caesarean section, just because we cannot induce labour with any hormone pessaries or tablets that go down below. The reason being is this could increase the risk of the scar breaking down in labour, as I've discussed before. So we can't induce labour at all, so it would automatically mean that you would need to have a caesarean section. Now, the plus side of having a vaginal birth after a caesarean section is that your recovery rate is a lot quicker. Your stay in hospital will be a lot shorter. The pain in your tummy afterwards will be a lot less, and it can increase the breastfeeding too. Plus, when you're at home, it will increase your mobility, obviously if you've got other children, and being able to get up and around with them too. Now, following this birth options appointment, if you haven't decided what you want to do, then that's not a problem. We will always offer you a further follow-up appointment at 36 weeks. And this is where we can discuss where you think you would want to go. If you're going for a vaginal birth after caesarean section, we will book your caesarean section in for overdue by 7 days. And if that's not something where you want to go and you want to have an elective section, we will book that in for you too. And then we'll also do like a bit of a birth plan with you, and just explain when you need to ring labour ward, what to expect, and just answer any questions that you have. Now, that's all it's all about, obviously, the birth options of the vaginal birth after caesarean section. If you do opt to have an elective caesarean section, that will be booked in for 39 weeks. You'll also need to see a consultant at around about 34 weeks, which we would book in at that appointment for you, so you'd have that all in place too. Thank you. I hope to see you soon back in the hospital. Take care.